Sure. So I have seen its growth, and I think one of the benefits when you place value over volume, um, you remove the barrier that you have to be involved in everything, right? And so, not that physicians aren't involved in their patient care, they are, but their income is really uh, limited to the hours that they can work and the patients that they can see. And I think value-based care really rewards them for the good work that they're doing and values more highly the contributions that they're making to our healthcare system. And so I have seen a growth. I think that there are a lot of physicians and even specialists now, right, as well. So primary and specialty physicians that recognize the importance of this work and just the ability that if you can improve health, you stand to be compensated appropriately, right? And so I think, again, I think that there are a lot of physicians that are excited about these opportunities because it's very tough when you're trading hour for money, right? Or service for money, and knocking away at things in that way. But if you're truly able to make a difference, which if we think about it, that's where the emphasis should be. That's what medicine is about, improving health. And if you put the focus there, you not only I get better outcomes, create a system that drives for better outcomes, but also too, it's a better business model when it comes to, again, not trading, service for service or hour for hour, but actually rewarding people for the good work that they do. As far as the barriers and the challenges, I would say interoperability still looms large as one of the biggest challenges in my mind. There are a lot of physicians that are wanting to adopt and accept this model. But unfortunately, the technology, even though there's been incredible advances in technology, the technology is not all where it needs to be. So as it relates to EMRs, right? All EMRs are different. I have seen where in a very large EMR company, I was part of a risk-bearing physician group that was implementing a very large, reputable, probably one of the better EMRs out there. And even that did not have risk tools built into it, or not in a way that I think is efficacious, right? Or that would help you be successful. Um, using alerts and not being able to really do good suspecting, making sure to, bring all the different bits of information across the healthcare system together to do suspecting on that patient. Those are the things that are missing. Connected medical records, knowing when knowing when a patient went to the hospital, what the outcome of that visit was, knowing when that patient went to a specialist, what the outcome of that visit was, and being able to connect all that information together. So I think that that's technology is probably the biggest challenge. When I think about what is a system and not only barriers, but also the things that can make it go, I like to think of there's really, I think, three inputs in value-based care. One is technology. And so, as I just suggested, that there's a lot of really great technology out there, screening devices that can capture conditions much earlier, even when they're asymptomatic. There's NLP, being able to read patient charts. There's all this technology out there at our, for our use. But unfortunately, I think that there's still an opportunity to bring that data together, as I shared, for interoperability. The other piece I would say would be on physicians, and it's getting the needed training and then I think organizing oneself. What I have seen in newer practices that are new to value-based care is that they tend to still operate in a way that is similar to how they operated under a fee-for-service model. And what you have to understand is it's not enough just to sign that contract and you're good to go. There's more work to be done. And so looking at programs that can diffuse cost, preventing patients when they don't need to go to the emergency care, right? Like if there's, or excuse me, to the emergency room, if there is a better site of service for them, like say an after hours line or an urgent care or Monday morning, right, in your office, um, those are important. You're taking the time to talk with patients about, how to care for when they have a COPD exacerbation or, how to monitor their insulin intake, better diet, smoking cessation. So all these things that we do around preventative health, making sure patients are getting their mammograms. I think that again, physicians have to remember that this is a whole system. It's not like you're just signing up for one piece. You have to be fully invested or you're not going to do well. And so you really have to take a hard look at your operations, make sure that your teams are set up, make sure that your teams are educated. Don't just assume, again, because you put something in motion that everybody's got to come along. There's lots of theories around change management and organizational theory that I think you need to think about of how do you revise your office and your workflow and your systems to support value-based care. Because what you did for fee for service is not going to work in this system. You're going to find yourself underwater pretty quick, like a lot of groups do, especially when it comes to managing total cost of care. The other piece that I would say, so out of the inputs, right, I said technology and physicians. The other piece I would say would be patients. I think that we have an opportunity to really educate our patients in a few ways. One, that they need to be proactive in their health. It's not enough to wait and get a symptom and show up to the doctor. That they need to be coming in for regular checkups. They need to not see that as a burden. And to the extent that we can engage them and educate them and families too, because I think you have to look at the whole unit. But how can you support them and educate them about how important this is and why it's better to have preventative care and potentially prevent disease, right? Than end up, in a scenario that no one wants. I know that there was a study done years ago, and they asked patients why they were resistant to their annual wellness exams or to seeing the doctor. And the number one reason was that they didn't want it to interfere with their quality of life. And so there was the concern that if they went to the doctor, they would find out something bad that would in some way change how they live their lives. They might have to take a medicine, right? That was super expensive, or they might have to change how they interacted maybe with their grandchildren. Um, I think that if we could talk more about how going to the physician, going and seeing your doctor, getting this preventative care would actually allow them to have more freedoms, I think would be important. Patient engagement um, would be, not only education, but just the expense and thinking about it differently too. It's not about the patient comes to see you and they pay their copay and then you get that fee for service payment. It's not like that anymore. And so how can you make it where they want to come in? It doesn't feel like a burden in every sense of the word. So you have to think about what are the things that are important for that patient? Is it money? Is it transportation? Is it social supports? And then how can you overcome those barriers? And then again, I think educating our patients of how important it is and how they help to, this is something too. I used to sit in on calls and would even take calls and talk to patients about encouraging them to get their annual wellness exams. And I think as a leader, that's really important to understand what your staff is going through and the challenges and the barriers and the things that may be coming up around your programs. And with patients, it was talking about again, why it was important. They might share with you, that they didn't want to come in, like I said, because they, didn't want an extra expense. They weren't looking to change their lifestyle in any way. And I think that I even got the reaction one time was that, we health plans or we provider groups, we were all about the money. And it was explaining to them, no, that's not the case, that actually we're trying to make healthcare better. And the emphasis should be on positive health outcomes. And by you coming in and participating, and so again, right, this is another way to motivate, but by you coming in and participating and making sure that you're getting your preventative screenings, you're adding to that larger healthcare system, right? And by being screened early and, cancer detection or other diseases early, keeping things under control, you're actually improving not only your own health and your own, freedoms, but also too, you're improving the system overall because your doctor's not, spending time taking care of things that could have potentially been prevented, right? They have time to spend on patients that really need that help. And then also too, you're saving on cost. And so when we complain about, the expense around insurance premiums and what healthcare costs, you're contributing, you're actually taking away, right, from the expense because you got treatment early or you got your screenings early. And so I think it's important to talk to those three stakeholders in those ways about value-based care in order to have a successful value-based care program. I do. See, I didn't even sure. I do. And I think that we could look at all the new programs that are coming out. I think that it may look different. There may be some hybridization, but I do think that CMS and other leaders are committed to this. I mean, just take a look at the different programs that have come out of late around, V28 and the final rule, the changes to the quality measures, the changes around auditing, the changes around, risk adjustment, the ahead model that's come out, I think involving hospitals more. And that's a recognition, right, that hospitals need to be connected to the system too. You have the guide model. There were just changes that came out around maternal health. We have things around behavioral health, changes around telehealth. Trying to think what else, dementia and the guide model. So all of these developments, I definitely think are pointing in that direction. So while all of these programs, I think will give us better information. I see them as beta cases, right, or pilot studies to see what's working, what's helpful. And I think that in time, we'll learn more, and then longitudinally we'll be able to decide what components worked, what didn't, and then again, it will be value-based care. CMS expects everyone to be in a value-based care model or a risk-bearing model by 2030. But again, how exactly that looks, I think it might be slightly different um, depending on all the pieces that I said, the interoperability, patient engagement, provider engagement, making sure that systems are overhauled. But I definitely think value-based care is here to stay.